Safety and privacy. Make sure you always wash your hands upon entering the room. It protects you and your patient. Closing the curtain for your patient's privacy maintains their dignity and shows your compassion to the clients and their needs. Verify identifiers on wristband. Watch for any allergy alerts or fall wristbands.
Hi, Mr. Smith. My name's Jessica and I'm going to be your nurse today. Can you confirm your full name for me and your date of birth?
Hi, my name is Stephen Smith. My birthday is January 1st, 2000.
Make sure you check your patient's baseline. After you check your patient's baseline, you can pump plus 30 above that for a proper reading. You should only be able to fit 2 fingers under the cuff for a tightness guideline. Make sure your patient remains still and doesn't speak while taking the blood pressure. Make sure your patient has no finger polish on. You may not get a proper reading. Stephen's heart rate is regular and strong. We time his beats per minute by 30 and multiply it by 2 if no irregularities. After we're done taking the pulse, we can move on and count respirations. Make sure your patient doesn't notice. Stephen's respirations are visible and non-labored.
Thank you. What brought you in today?
Well, I was at the skate park trying a new trick, and then I fell off my skateboard. I hit the left side of my head pretty hard on the cement, and I guess right away I started getting this throbbing headache that hasn't seemed to go away. So I came straight here. It was about an hour ago when it happened.
Oh, I'm so sorry that happened. On a scale of 0 to 10, with 10 being the worst pain you've ever experienced and 0 being no pain at all, how bad is your headache right now?
Well, it's a constant throbbing pain, so I guess a 7 out of 10? It hurts pretty bad, but bright lights and sitting up just makes it worse. At least when I lay down or close my eyes, it helps a little bit.
Have you taken anything for the pain?
No, I came straight from the skate park.
Were you wearing a helmet at the time of the fall? Yeah, I know that no one really likes to wear helmets, but we need to remember that they are an important piece of protective equipment for many sports and activities, and they can prevent serious hand injuries. When you pick out a helmet, just remember your 2v1 method. So 2 finger widths between the eyebrow and the bottom rim. The chin strap should form a V just below the ear, and 1 finger width between the chin strap and the chin.
Thanks. I guess moving forward I should wear a helmet. I really don't want anything like this to happen again.
Mr. Smith, do you have any allergies?
Yes, peanuts. They give me full body hives. I usually take Benadryl 25 milligrams to help ease the itch, I guess.
Do you have any medical conditions or medications that you take regularly?
I have type 2 diabetes. I take metformin at 500 milligrams twice a day. I have eczema on my hands, so I take cortisone cream every morning.
Do you smoke, do drugs, or drink any alcohol?
No, never.
Do you feel safe at home?
Of course.
I'm just going to do a quick neurological assessment. Mr. Smith, can you tell me where you are right now and today's date? And do you know who I am?
In the nursing department, today's July 1st, 2026. You're my nurse, Jessica.
Okay, Mr. Smith, I'm just going to do an inspection of your head and your neck. If you could just look at me and smile. Okay, can you frown? Puff out your cheeks like this. Okay, I'm noticing very symmetrical movements on both sides of your face. Now I'm going to just check out the back. If we just look at it. Okay, Mr. Smith, now I'm going to move on to palpating your head and neck, which means that I'm just going to touch around on your head and neck. If you could let me know anywhere that's tender or that hurts, please let me know, okay? So I'm going to start on the top of your head. Oh,
Ouch! That's exactly where I hit my head earlier.
sorry, that's where it hurts. Okay, I do feel a large bump there. Okay, I'm just going to move to the back of your head, to the side of your face, down into your neck. Did you find any other tenderness or anywhere sore when I was touching?
It really hurts when you put pressure on the spot where I hit my head. But other than that, I guess nowhere else. Although now that you mention it, my neck is feeling kind of sore. It was especially sore when I jerked my head away when you touched the tender spot on my head.
Smith, I just want to check your balance and coordination. Could I get you to just stand up and walk from one side of the room to the other? Okay, that was really good. Now, if I could get you to just stand there with your eyes closed, we're just going to check your balance. Mr. Smith, are you feeling tired?
Yeah, but I wasn't when I got here. But all of a sudden, it's hard to keep my eyes open.
Okay, Mr. Smith, I'm going to perform a whisper test to test your hearing. I'm going to stand behind you and whisper a letter and a number sequence. While I'm doing this, can you please block your ear? I'm not testing by covering your tragus and pushing down. Please repeat the sequence and then we'll move on to the other side. We're going to start with your right ear. Okay, P4Q.
E4Q.
Okay, that's good. I'm going to move to your other ear. 6B3.
Sorry, I didn't really hear that. It sounds really muffled in my left ear.
Okay, Mr. Smith, now I'm just going to check your pupil reaction to light. I'm going to start in your left eye and shine a light in it, and then I'm going to move to your right eye. If you could stare right at me, that would be great. Okay, we're going to start with the left eye. Good, and now I'm moving to the right eye. Perfect. Okay, and now I'm going to test your pupil accommodation. So if you could just stare at my pen light, and I'm just going to move it closer. Perfect, thank you. Okay, Mr. Smith, is there anything you need before I leave? All right, thanks. Have a great day.
When leaving the patient's room, make sure they don't need anything. Give the patient the call bell, bed to the lowest height, and 2 side rails are up. Make sure you do your hand hygiene on the way out. Make sure you timely document your findings after your patient assessment is very important. Nurses who need to take care of your patient or doctors who will be relying on your notes to make decisions on your patients require accurate and timely documentation in front of them. Patient received into care at 1300. Vital signs taken. Patient reports to have a throbbing headache after falling at the skate park, hitting his left side of his head on the cement. No protective helmet was worn. Patient educated on importance of helmet. Pain was rated a 7 out of 10, claiming sitting up makes it worse and closing eyes helps subside the discomfort. Sensitivity noted while palpating left side of head directly above his ear. Large bump around 4 cm by 4 cm measured. No open areas on skin seen. While performing the neurological assessment, patient appeared to be sleepy and reports it came out of nowhere. Muffled hearing while writer performed hearing assessment in left ear. Patient is orientated to person place with mildly altered alertness.
Hello, this is Jessica, student nurse in the emergency department. I'm calling about Stephen Smith in room 1. He came into the emergency department after falling off his skateboard and hitting the left side of his head on cement at the skate park. His blood pressure is high and he reports a constant throbbing headache rated 7 out of 10. He came in right after the incident and no change in pain level has been noted. Stephen has type 2 diabetes, treated with metmorphin, and an allergy to peanuts that causes full body hives. However, he manages it with Benadryl. He is oriented to person, place, and time. However, he is becoming increasingly sleepy. There is tenderness and mild swelling on the left side of his head, and he reports neck soreness and muffled hearing in his left ear when I whisper behind him. I'm concerned about possible neurological issues after his fall.